Thank you, Dr. Feng. So beyond treating serious disease, cell treatments is now improving everyday health and beauty. So it shows us that medical progress is not just only about survival, but also living well and feeling confident. So now please to have Dr. Huang Yen-Kai from Mackay Memorial Hospital, who will share how cytotherapy is transforming dermatological care. So please welcome Dr. Huang.
Okay. Good afternoon. I'm Dr. Huang from Taiwan. Today I want to introduce the application of the future prospection of exosomes in dermatology and aesthetic medicine. I'm a dermatologist, and in my daily practice, I practice dermatology and cosmetic clinic. And I run the clinic in Taiwan, and I do the dermatology and aesthetic medicine in my daily practice. Okay, in the first, I want to briefly introduce the exosomes. You know, when the cells communicate each others, the cells will secrete some exosomes from one cell to another cells. And then we found that there's 3 or 2 vesicles between the cells. One is the atopic bodies. They could give a message to another cell so you can adapt to the physiological functions. And then another is the microvesicles, and then the exosomes. So today I want to introduce the exosomes. We know that in these vesicles, the exosome is the size of exosomes is very small. It ranges from 30 to 100 nanometer with a cup shaped. And then the structure of exosome, it contains a lot of materials, include some ligands, non-coding RNA, DNA, and growth factor, and a lot of immune regulator with a bilayer lipid membrane. And then this exosome can regulate the recipient cell to do their physiological function like apoptosis, migration, or inflammation, or that can anti-inflammation effect of recipient cells. So it's like it can regulate the recipient cell to do a lot of change of physiological functions. Okay, so how to find the exosomes? Maybe we can find the hallmarkers. So there's some hallmarkers in the exosomes, like CD181 or CD9 or CD63s. Like the exosome contains this CD marker, and they have a lot of physiological effect in our between cells. Okay, so there's a lot of ongoing trials, include a lot of field of disease. For example, cancer or neurological disease or cardiovascular disease. So there's a lot of different cell treatment or exosome-related treatment in different fields of the system and disease. So just Dr. Huang mentioned, and this we use the exosome or collect exosome from 1968. But there's different source of exosomes. But just Dr. Huang mentioned that the amyloid fluid stem cells is a very good and valuable source of the source and can collapse some exosomes. We can use that to do a lot of effect and treatment in our clinic. So this is the amniocentesis as a prenatal diagnosis procedure where fetal cells from the amniotic fluid are obtained. So we obtain this, the FSC, and then we find that some study shows they can differentiate into different tissues. So they can enhance different cells and different several tissues. So today, because I'm a dermatologist, so I want to share some experience of my clinical experience in the dermatology field. And I will introduce the wound healing and the immune disease and some medical assets. And before that, I want to briefly introduce the skin. Everybody knows skin have epidermis and then subcutaneous. And in the wound healing and scar is a very difficult province, okay, in our clinic. And in the stage of wound healing, there's 3 stages. One is hemostasis and inflammation, is proliferation and remodeling. And we'll get into the scar. And the most important stage is proliferation stage. In the proliferation stage, we can find that the cellular proliferation and migration. And we need the VEGF to promote angiogenesis, and the keratinocyte would need migrate to the wound, and the extracellular matrix deposition were noted in this phase. And then we get to the tissue remodeling, and then get to the scar. But sometimes in a lot of surgery or a lot of trauma, we get a not very good scar, right? Not very good result. For example, this 23 years old woman is a very young lady. In open wound, we have an open wound from traffic accident, and she received graft. Skin graft is a very common procedure in the plastic or dermatology surgery. And after healing, she have a very uneven skin texture and the color mismatch. So in the past, the wound will get into the scar in the classic wound healing, scar formation. But if we have some cell therapy or regeneration therapy, maybe we can like salamander. Salamander can regenerate their limb for the entire limb. So if we have new weapons, maybe we can change the way of the scar formation, go to the skin rejuvenation. Okay, so I'll try to use the IFSC to treat the wound of our patients. Okay, first is example. If after we see the wound, first step is not use the exosome. First step, we need to do the traditional wound care. For example, we need to debride our skin, prepare our wound. Okay, this wound have some contact dermatitis because of some ointment. So we use some steroid and anti-inflammation ointment to clean the wound. So the wound bed preparation is the first step of wound care. Okay, after appropriate wound care, we need intensive intervention. Maybe we have the appropriate wound care or skin graft, even the negative pressure wound therapy, and then we have exosomes and cell therapy. And we will get to the rejuvenation of skin, our final goal, right? Okay, this is example. It's a severe burn. Okay, it's a young lady, but we use because other doctors say you need to give a skin graft operation, but she come to our clinic for secondary opinion. So we use the strategy of secondary intention healing. Okay, we use the appropriate wound dressing and exosomes. You can see the wound recovery is very good, and the scar is acceptable, right, compared to the traditional method. So, but the severe wound is not very common in our clinic. In our clinic, most of the wound is come from iatrogenic wound because of cosmetic procedure. We leave a lot of wound. So, for example, if everybody know HIFU is a device that we can rejuvenation. So, the HIFU, the microfocus transcutaneous ultrasound, can give us a thermal effect to let our skin produce more collagen and result in rejuvenation, right? But if the device have some problems, maybe we could not control the thermal effect, the burn will happen. Oh, this is a tragedy, you know, because patient come to our clinic seeking beauty, but not the wound or injury. So this is a legal problem. It will be a legal problem if we don't treat appropriately. Okay, so this patient, they have a burn injury. At first, we use the traditional treatment, use the ultratransarmin, steroids, and very intensive wound care. But 1 week later, the injury is still noted, the burn still noted. So we are very nervous. So we want to try exosomes because after 1 week, maybe they would go to the scar, permanent scar. They will be a very big problem. But if we use exosome, because exosome has a very good anti-inflammation effect and the wound heal, it would help us to wound healing. So the treatment is very amazing. So that they only have some pigmentations. So we use some laser and the old pigmentation disappear. Okay. So exosome is a very good weapon to do wound healing and anti-inflammation, and then they have the potential effect of the skin rejuvenations. You know, in the aging process, we have some change of our skin. It's the epidermal thinning and the solar eclectosis. There's some material deposition on our epidermis, and the dermis. And we will find there's AMPS is a marker for aging increased, and the function of fibroblasts decreased. And we have a lot of senescent fibroblasts, and hyaluronic acid decreased. So this is a normal aging process. Okay, so we find that exosome can enhance our fibroblasts and produce more collagens and help us to do the preparation of the keratinocytes and increased dermal fat. So this interesting study shows there's the two groups of mouse. And at first we used UV irradiation to create the very old skin on the mouse. And then we divide two groups. One group we create some hole, use the sponge spikes, some needles, and then we apply the exosomes. Another group we use a control group without any exosomes. And then we found that the fibroblasts can catch some exosomes. So there's an enhancement of the fibroblast. And then we found in the exosome group, this is exosome group, the cell proliferation of fibroblasts is elevated. And the senescent rate is decreased. Senescence, the old fibroblasts decreased. And the cell number of fibroblasts are increased. And then we find that the collagen 1 mRNA or the electin fiber mRNA is increased, and that AMP1 mRNA is decreased. It's an old marker. So that is to prove that the exosome can be the rejuvenation potential effect. And then they do another trial that if we only apply the exosome on the surface of our skin without any wound, we still can see some exosome in the skin. But if we use the SHS, it's a spical needles or a sponge needles or some wound on the surface, the exosome can spread into the entire skin. So this study also shows that the exosome can have some anti-inflammatory effect. We can see the number of cells. The cell is the T cells, the inflammatory cells decreased after 72 hours after the exosome applied. So we found that exosome have some aesthetic potential. So in my practice, sometimes if patient they want to the long-term rejuvenation effect, we can combine the exosome with hyaluronic acid. Because we can see if, for example, the patient has nasolabial fold and sometimes eye bag, right? And depressed cheek because of volume loss of collagen. So we inject the hyaluronic acid in my routine cosmetic procedure. But when I inject hyaluronic acid, there is some inflammation reaction where appears. So if I combine with exosomes, patient will be comfortable after hyaluronic acid, etc., and they have a long-term fibroblast, long-term rejuvenation effect. So acne scar also is a very difficult disease in our clinic. So some study shows they use the exosome or control gel to treat the scar. And the exosome is, we can see the clinical photograph, the exosome is improved compared to control group. But they use the laser therapy and then use the exosome. You know, in our experience, we only use laser therapy. If we only use laser therapy, the result is not promising. But if we use some exosomes or regeneration therapy, the scar will improve a lot. So in the data analysis, the study shows that not only clinical appearance, the skin pore and the skin roughness also improves. Okay, this is my clinical case. This is a depressed scar, right? Depressed scar. And we use the laser several times, but it's not so promising. And after we use the exosome with a skin subcision, inject some exosome under the skin. And after about 5 or 6 months, we see the very promising result. Okay, another big field is the whitening and the anti-pigmentation. You know, this is a big market, right? Everybody wants to whitening and anti-pigmentations. And the disease is a melasma. Melasma is a very difficult pigmentation. It always started on about 30 to 40 years old in the Asian lady or Asian females. In the past, we do a lot of laser therapy. I want to break the melanocyte. But actually, it's not a pigmentation disorder. It's aging disorder. It's not pigmentation disorder because we find that in the melasma patients, not only melanocyte increase, but also the basement membrane. This membrane get weaker. The epidermis is thinning, right? And we saw there's a lot of senescent fibroblast and inflammation disease, inflammation phenomenon. The mast cell, the inflammation cell were increased. So this is the pathogenesis of melanocyte, not just the melanin or melanocyte. Because after the break of the base membrane, the melanin migration to the dermis, and then it's very difficult to treat. So if we use exosome have the efficacy of repair our base membrane and inhibit the mast cell or inflammation and enhance the function of fibroblast. So it's a very good weapons to do the whitening and anti-pigmentation. So this case has inflammation and the pigmentation. We use the exosome with microneedling, and then the patient feel satisfied of the treatment. We don't need to use laser, right? We don't use laser because if we use laser is so powerful, it will break our skin environment. Okay, so in the skin analysis machine, we can see the pigmentation were all gone. Okay, another disease is rosacea. Rosacea is an inflammation disease in the skin on the face. You will see the red face on the patient's skin, and they are very there's a social interaction is not so good on their daily life. So rosacea is a chronic inflammation skin condition, and then about 10% of adults have this kind of situation. You have facial redness, flushing, and sometimes it's papules and pustules, and some telangiectasia on her face. Okay, and I use the microneedling plus FSC for 3 times. We can see the redness disappear and the skin quality is improved. Okay, the red light also shows that the inflammation is very improved a lot. Okay, this is another case of rosacea because she complained about very redness and itchy and uncomfortable on her skin. But when I use the FSC, the skin condition is improved. Okay. So we can see the skin become more hydrated, skin quality improved after use the exosomes. Okay, even skin pore is improved. If your skin more healthy and skin quality improved, the patient will be very happy about that. And the last is the hair regeneration. I thought this is another potential application on our market, right? In the traditional traditional treatment, we use maybe minoxidil or some finasteride oral tablet and or some low dose laser or PRP to treat our alopecia for our hair loss. Okay, but the study shows that exosome can enhance the hair follicle growth and improve the density of hair follicle. Because we found that exosome can increase some growth factor on around the hair follicle and improve the proliferation of the hair follicle stem cells or dermopapillary cells or other important structure of the follicles. And then there's a lot of papers shows that exosome can help us to treat our alopecia or hair loss. This is the adipose-derived stem cells. After treatment with the 2 or 3 times, we can see the hair regrowth. Okay, this is a very famous journal in the dermatology that also shows the exosomes can help us to treat the hair loss. And the sonograph also shows the hair follicle increased a lot after 6 months. So this is a female pattern alopecia because it's not androgenic alopecia. It's when female get older, about maybe 40 years old, she will complain about their hair will decreased. So we use the exosome, include exosome as a very good weapon for the androgenic alopecia. At least only 1 shot of exosome, the hair growth is improved. And this is another female. He feels her hair density decrease. So we used FSC exosome, treat for 3 times, and we can see the hair growth. Okay, so take-home message is, I thought the exosome is a very good weapon to combine our treatment in our daily practice, include wound repair or skin rejuvenation or anti-inflammation or hair regeneration. I thought it's a very good weapon, and so far we need to more study and more clinical case to prove that it's a good weapon on our in the exosome. Okay, well, thank you very much.